The highly infectious disease unit of the Kenyatta National Hospital took in the country's first coronavirus patients. Tonight, NTV has gained rare access to the isolation unit at the facility where the most critical patients are attended to and shows the extreme measures taken to protect the healthcare workers and battle the coronavirus pandemic. Leila Mohammed reports.
The special unit set apart within the Kenyatta National Hospital campus only hosts medical personnel and patients who are undergoing treatment for the coronavirus that has upended lives in most of the world. Movement in and out into the infectious disease unit is controlled to maintain the virus within these walls. Once inside, every precaution is taken to ensure that those coming in have a temperature reading of less than 37 degrees, and if the temperature is higher, one will be taken in for treatment. In between each step, medical staff and guests are expected to sanitize before dressing into the personal protective equipment that is needed before they can get into the wards. On this afternoon, we get our first glimpse of the fight against COVID-19 while walking these white halls, with a word with those isolated here clinging onto hope that the efforts of their caregivers will pay off. While some were up and about, beaming with hope for a better day soon, some who are not in the best of health were clinging to their lives in their hospital beds as healthcare workers dispensed medicine and monitored their progress. The government says they are getting the best care possible. Most of the world is using chloroquine and antibiotics to treat their patients and who have recovered. A universal cure and vaccine is still being sought, but at the moment, those who are battling the disease can only hope that they get better soon. The ministry says that it will increase the capacity of healthcare workers to battle the disease, even as some among them have fallen ill while in the line of duty.
The additional 1,000 workers that we will be hiring, those are going to be who are going to be more specialized. We are obviously going to start off with a greater increase for the counties that are currently in dire need and move and increase as we go along should there be need. But for now, we feel that's a good number. We have already basically mapped them against the health facilities that we have already designated.
It is here that we caught a glimpse of the respirators aiding those with breathing difficulties. The corridors here might be cold and lonely for those undergoing care, but on the other side, those who are also being monitored after interacting with the ill are getting the lunchtime nourishment when our cameras visited the wards. Before leaving, the procedure to remove the PPEs follows strict measures just as before in order to keep the virus on the outfit and out of the public. Leila Mohammed, NTV.